All right, we're going to go ahead and get started while you guys are all eating. I just wanted to quickly mention the clubs that are co-sponsoring this event. They're all on your paper that you all have as well. We have the American Medical Student Association, the Student Chapter of the American Osteopathic Academy of Sports Medicine, and the Student Osteopathic Medical Association, as well as the Missouri Osteopathic Student Association. So we're really grateful for them in co-sponsoring this event. I'd like to turn the time over to Dr. Wilson real fast to do the introduction of the panel.
Welcome. While you're eating here in just a second, we're going to show a brief video just to kind of get you in the mood for National Health Service Corps. But I would like to introduce Dr. Chris Halliday. Dr. Halliday is the new dean for the Missouri Dental School. So we're very grateful to have him. And he's going to talk a little bit about the Indian Health Services and how that fits into the role. Dr. Tim Hertz, who should be here shortly, is a dentist at a community health center here in Kirksville. And he's going to kind of tell you a little bit about his experiences. And then hopefully online we'll have soon Mr. Clark Conover, who's with the HRSA office at Region 7 in Kansas City. So we're good. Somebody give me a hint where we get this started. All right, great. So just enjoy your lunch for a minute. Make sure you get an extra potato before it's all over.
A hero is somebody who does something extraordinary. I'm not doing anything extraordinary. Ready? I'm just doing what I do, what I enjoy every day, and hopefully make somebody else's life a little bit better. That's really what I went to medicine for, and that's, I believe, what the National Service Corps understands, is that it really is every day, one patient at a time. You know, I think every community has its own cultural challenges. We, for example, we're a shrimping town, and people make their living on the water, they make their living on the shrimp boats, and that industry is very depressed economically, and it's tough for them. And those things really affect their medical care every day.
Yeah, we're just strictly a shrimp boat. We catch shrimp. We travel from the west coast to the east coast. I went to the galley table, sit down, I had me a cup of coffee, and my hand was itching, and so I got either a spider bite or shrimp poison in my wrist. We're usually gone anywhere from 45 to 60 days at a time. That makes me feel great to know there's a doctor that's in town, that's close by, that would be here to give support to my children if help was needed. It makes me feel really great.
I'm just proud to be here every day. As I think about, you know, there are individual patient stories that are really touching, that I really was glad I was able to be a part of those patients' lives.
I give her a hug every time I come down here. Hey, I adopted her. I'm her mama.
Oh, the best thing about this community is the community itself, the people. They're warm, they're loving, they take care of me. They already have, so you'll miss it tomorrow. They really are a wonderful group of people.
Dr. Benjamin is my hero. Everyday hero.
Don't not no way. It makes me feel wonderful. I don't feel like I'm giving to the community. I think they're giving to me. I get much more out of seeing patients and treating them every day. When I was in medical school, I was in the second class of Morehouse School of Medicine, and there is where I signed up for the National Health Service Corps scholarship. They paid for my education, and in return, I agreed to go to an underserved community. I've been practicing in biobattery for, let's see, about 15 to 17 years.
I love you.
Love you too. Now I gotta get Nell in here because she's got a cold, trying to play hooky. I feel like I've made a difference each day, and that's priceless.
Anybody know who that is? Dr. Regina Benjamin? You don't count, Janet. Anybody know who that is? Dr. Regina Benjamin, National Health Service Corps Scholar. She's the Surgeon General. So you too could be the Surgeon General. Wow. And Dr. Halliday was Assistant Surgeon General and was her Chief of Staff. So I think it's just remarkable, and I've showed this clip for years because this video is actually kind of old, that this is her background, where she came from, was as a National Health Service Corps working and serving as a family practitioner in an underserved community, and to take that all the way to the national level in service as our Surgeon General is pretty remarkable to me, and we're very, very fortunate to have Dr. Halliday here today also as part of that. I wanted to give you just a little overview of the National Service Corps, because I imagine most of you are here today because you want to hear a little bit about it and what that might mean in terms of your interest. The National Service Corps is an entity that provides service to underserved communities. It's made up of clinicians and healthcare providers that serve in underserved communities to those that need health care the most. Some people are under the misconception that it's only rural areas. It's not. It can be rural, urban, the prison system, Indian Health Services, which Dr. Halliday has been a part of, and we'll talk about a little bit more. Frontier communities. If you know Dr. Tom McWilliams on the Arizona campus, he was part of the Frontier community as a scholar that went to Alaska and has many stories to tell. So it can be any place that there's patients in need, communities in need of health care that where you as a National Health Service Corps physician could serve. Where do they serve? They serve in places called HPSA shortage areas, and those are health professional shortage areas. So if you choose to participate in the National Health Service Corps, you wouldn't necessarily be able to go to a boutique practice down the street of your local community, or maybe downtown Manhattan. You're going to go up in a community of need, and this is a federal designation called a HPSA score that these communities receive to kind of rank the severity of need there. The other thing to tell you about National Health Service Corps, intent is to provide primary care. So if you want to be a vascular surgeon, if you want to be a dermatologist, take your potato and you can take it on down the hall and eat. But because this is for primary care, again, to make sure communities of need get the services they need for basic primary care. Now what that includes in the federal definition is family practice, general internal medicine, general pediatrics, OB-GYN, psychiatry, general psychiatry, and then also includes if you have like an IM Peds or an IM FP or geriatrics in most cases. So, but again, it's targeting primary care for those in need. Again, the HPSA scores, when you start, if you get into this, you start looking, you'll see the HPSA score. The higher the score means the greater the need. So if a site, a community, a clinic, a prison, wherever, if it has a score of 17, that's one of more need than a score of 13. So the higher the score, the greater the need in terms of HPSA scores. And again, a National Health Service Corps site can be any community-based practice. So it's not going to be a hospital practice. So if you're going to be a hospitalist, again, you could not be part of the National Service Corps, but it's going to be a community-based practice. That can be a private practice, so you could set up your own practice, in your hometown community if it met the HPSA designation. It could be part of a already established community health clinic, federally qualified health center, rural health clinic, Indian Health Services, or the prison. So again, there's lots of different choices of opportunities as you might explore this. And again, it's, the bottom criteria is that these sites have to, be of service-oriented primary care and going to be serving populations regardless of their ability to pay. So that basically boils down to that whatever type of site you might practice in would have to have a sliding fee scale for those that might be uninsured or low insured that they could pay based on need. So those are lots of different opportunities. There's actually 3 different pieces to consider for National Health Service Corps. I'm going to talk about each of those briefly. One is the scholarship program. Do we have any scholars in here? Yeah, 1 scholar, awesome. We have about 1 or 2 per year. There's the loan repayment program, and then there's a new one called student to service loan program. So there's 3 programs. The traditional scholarship program is where you apply your first year of medical school. You can't apply second also, and they pay a stipend, monthly stipend. They pay your tuition, kind of all your expenses. I was a National Health Service Corps scholar, so basically, got all my tuition paid each year that I committed to, and had a monthly stipend to help offset expenses through school. It's a minimum 2-year service, so you have to sign up for a minimum 2 years payback, all right? So you can do between 2 and 4. But the problem with the scholarship is there's very few scholarships given. So you're very fortunate if you got a scholar. It's probably not likely for most of you, all right? It's certainly something to explore if you have an interest, and would encourage you to apply. But odds are that there's going to be very limited. Again, we usually have about one or 2 per class per year at K-SWIM. They generally choose maybe about 200 in the whole nation out of literally thousands and thousands of applications. But it is one pathway. The one that probably is most common these days is the loan repayment program. This is one that you would look at as you're a resident, kind of starting to think, where am I going to set up practice when I get out? What can I do to offset my loans by some payback? And this is definitely one that I would highly suggest you investigating further down the road if you have an interest in this service with National Health Service Corps. Again, you're going to apply when you're a resident, and then they're going to pay off student loans when you get out in practice. So you go to a HPSA designated site, you're going to get loan repayment based on the HPSA score of the site. The higher the score, the more need, you'll get more money. And again, you have a minimum of 2 years commitment, but you can go up to 5 years and beyond even. We have had some, and Dr. Herbst, I apologize, he currently could not get here. He's our dentist at our local community health clinic. He's been on the loan repayment for I think 7 years, so there is potential to kind of keep that rolling. And a very good way to provide service and to look at loan repayment for student loans. They do now actually even have a half-time service that you can do with loan repayment. So if you were to serve, say, half your time at a HPSA designated site, and maybe your other half had some other kind of practice, or maybe you're a hospitalist during that time, you can do a half-time. That's kind of a new part of the program in the last few years. Of course, it's less money because you're spending less time with your National Health Service Corps site. This is the latest program that they've implemented. It's called Students to Service Loan Repayment Program. It just came into being, I think, and is Mr. Clark Conover on phone
No,
yet?
but I can look at it.
Clark will know. I think it's been out maybe 2 years now. I know one of our students for sure got this loan repayment program as she was a senior year at K-SWIM. It's one that you would apply for during your last year of medical school, again with the intent you're going to go into primary care, and you can then apply for the loan repayment instead of waiting until you're graduating from residency. You can actually apply for it in your last year of medical school, and again get your loan repayment status taken care of. Again, misconception, I think people think sometimes, well, okay, I sign up as for loan repayment, they're going to send me somewhere I don't want to be. Absolutely not. They want to match physicians, providers of all kinds to communities that they're going to be successful and want to stay. You know, I think their ultimate goal would be to put themselves out of business. So healthcare was dispersed across this country in an equitable way that every patient could get care. So they're going to try to, you know, make it a feasible thing that you're going to a site you want to be at. So most of the time, you're going to choose that site. If you're a scholar and you couldn't come up with a site you wanted, you might be assigned. But in every other circumstance, you're going to have the opportunity to choose your site. Maybe it's your hometown, maybe it's an existing community health clinic or other system, but you're going to have the opportunity to choose the site that you serve, whether you're a scholar or a loan repayment person.
Yep.
And again, we'll send you out some information via email, but if you have questions or you want to learn more about the programs, there's a good website that you can go to that really answers a lot of the questions, give you specifics about the program. We'll talk a little bit more about those in just a minute. Is Mr. Conover there?
I think so. Can you hear us?
Hi, Doctor. Yes, we're here.
Hi, Clark. How are you?
We are well. Is this presentation on productivity issues with EMR and technology?
It's kind of along the same lines.
Well, we appreciate any opportunity to communicate with the good folks at ET still.
I think we're going to have Dr. Halliday talk next, just a few minutes again about the Indian Health Service, which is one way of fulfilling your obligation. And then we'll turn it over to Mr. Conover in Kansas City.
I think I'm at the PowerPoint at the bottom. Oops, no, there we go. All right, great, thanks. Well, hi everyone. My name is Chris Halliday, and as Dr. Wilson mentioned, I'm the Dean of the Missouri School of Dentistry and Oral Health. I came to Kirksville after serving 24 and a half years with the U.S. Public Health Service, so I'm going to kind of give you a quick overview of the Indian Health Service. Of my 24 and a half years with Public Health Service, I spent the first 23 years with the Indian Health Service started as a clinical dentist and ended the last 10 years as Chief Dental Officer for the Indian Health Service. And just real quickly, I served initially in Alaska, and then New Mexico, Arizona, and then in Rockville, Maryland. But to give you kind of a quick overview, the Indian Health Service is the federal agency which provides health care to American Indian Alaska Native individuals. So through treaties between tribal governments and the federal governments, the U.S. government provides health care to American Indian Alaska Native people of federally recognized tribes. And the Indian Health Service has a population base. They serve approximately 2 million individuals, and they have hospitals and clinics in 35 states across the country. Most of the hospitals and clinics are located in the western half of the U.S., but they do have clinics, as I mentioned, in 35 states. And the mission of the Indian Health Service is to raise the health status of the American Indian and Alaska Native people to the highest possible level. When we speak with the Indian Health Service, we always talk about opportunities, purpose, and the adventure of working with the Indian Health Service. So, real quickly there, I want to let you know that Indian Health Service has a multidisciplinary healthcare program. It's not basic medicine or basic dentistry. It is a comprehensive healthcare program. It's multidisciplinary, and I'll get in a little bit more detail about the types of physicians that are employed by the Indian Health Service. Another misconception is a lot of folks feel that because the tribes are located in remote rural parts of the country that the clinics and hospitals probably are second rate or not very nice. It's not the case. I'll show you some pictures. The Indian Health Service has placed a huge emphasis on having very nice, modern, well-equipped hospitals and clinics. The adventure of working in the Indian Health Service, well, you get to live in some of the most, I think, coolest parts of the country. The Indian Health Service does it. They do have facilities in urban areas, but by and large, most of the hospitals and clinics are in rural areas, and some of them are even remote areas. But it's a fun area to live. Generally speaking, if you enjoy outdoor activities, if you enjoy the outdoor lifestyle, it's a really cool place to work. back when I was out in the field in the Indian Health Service, I was about 20 pounds lighter and used to do a lot of camping, a lot of hiking, mountain bike riding. The downhill skiing in most of these areas is fantastic. The purpose, well, once again, we want to raise the health status of the American Indian and Alaska people to the highest possible level. And what we've done with the Indian Health Service, I say we because it's hard for me to separate 24 and a half years of service, even though I'm no longer with the Indian Health Service. But what the Indian Health Service has done is they've, I think, done a very cool job of integrating traditional health, traditional healing from the tribes with what the tribes call Western medicine. So the physicians in the Indian Health Service quite often work alongside traditional healers, medicine men, and that sort of individual from the communities. Real quickly, there are more than 6,000 healthcare providers employed by the Indian Health Service. Indian Health Service, once again, is multidisciplinary. So there's physicians, there's nurses, there's dentists, there's pharmacists, there's engineers, sanitarians. It's a wide variety of healthcare providers. Indian Health Service has been in existence as it is in its current iteration for over 50 years as well. It's a community-oriented approach, so I think all of you here at KCOM are very well familiar with the community-oriented approach to healthcare. That's the whole reason I came out here to work with you all in the dental school, because I really like what you're doing with community-centric and community-oriented healthcare. There are more than 1,000 physicians in the Indian Health Service, and they have a wide variety of specialties and types of care they provide. This is some of the examples of the different specialties of medicine that the Indian Health Service utilizes. That's not an all-inclusive list, but that just gives you an idea that it's a pretty comprehensive array of physicians that are employed. Okay, real quickly, there's different opportunities to come to the Indian Health Service. You can either come in as a federal employee or as a tribal employee. As time goes on, more and more the American Indian, Alaska Native tribes, or corporations, as they call them up in Alaska, are assuming management of their healthcare programs. So we're seeing more and more healthcare providers that are being hired under the direct tribal path, where they work directly for the tribes. But there's also two different types of federal path. There's the Commissioned Corps of the U.S. Public Health Service, which is one of the 7 uniformed services in the United States. I was a member of that uniformed service. And there's also the civilian pathway. So long story short, as a physician, if you wanted to come to the Indian Health Service, you can come in as a federal employee, as a member of the uniformed service, a civilian, or you could come in working directly for the tribes. Any of those 3 choices are great choices. I wouldn't steer you away from any of those 3. Okay, this is probably what you're most interested in. You want to hear a little about loan repayment. The Indian Health Service has a very comprehensive loan repayment program. Physicians and dentists are prioritized for the receiving loan repayment. I know for a fact in the last 11 years, every single dentist who's applied for loan repayments received it, and physicians have top priority. So I know that the waiting list for loan repayment for physicians within the Indian Health Service is very short. I think virtually all physicians receive loan repayment probably within their first year of coming to work, and hopefully you would receive a loan repayment contract at the time you're offered a job. Loan repayment in the current program in Indian Health Service, on top of your normal salary that you would receive, it's an additional $24,000 per year, and there's an allocation for taxes too, so that you're not dinged too hard on either state and or federal income taxes. But once again, the key here, that extra $24,000 per year for you to apply to your loan institutions is on top of your normal salary. It's not, they don't deduct that from your salary. There are some requirements to receive loan repayment in Indian Health Service. You do need to be a U.S. citizen. In order to receive loan repayment, you need to have a valid job offer, and you need to be available to work by September 30th. And what that really means is the Indian Health Service has a fiscal year which goes October 1 through September 30th. So if you were to graduate, let's say in June of a given year, if you wanted loan repayment in that fiscal year, you need to start working by September 30th. That does not mean that you couldn't receive a loan repayment contract in October, November, etc. They award these contracts year-round. The initial loan repayment contract carries a 2-year service obligation. So if you agree to take a loan repayment contract with Indian Health Service, they ask you to sign an agreement that you'll stay at that site for 2 years. And at the end of the 2 years, you have the option of renewing your loan repayment contract on an annual basis. With the Indian Health Service, you can stay on loan repayment as long as you like. I know dentists that have been on the IHS loan repayment program for 17, 18 years. Basically, they're making a whole career in the Indian Health Service, and they're receiving loan repayment throughout that career. So there's no time limit. It's as long as you like. Of course, you have to be able to show that you're applying that money towards your loans. Real quickly, I won't go into a lot of detail here because this would be a whole hour lecture in itself, but there are externship opportunities in the Indian Health Service. So there's several different types of externships you can do. If that's something you can work out with KCOM administration as far as a leave of absence from the program, do an externship, I'd be glad to talk to you about that sometime, or I could point you to the right person to talk with you. Real quickly, Indian Health Service has locations in remote sites, in rural sites, and we have a few urban sites as well. That's down the southwest. That's on the Navajo Reservation, that picture there. An example of a remote site would be in Pawnee, Oklahoma. So that's just one of the older health stations. There aren't many of those left anymore. Pretty much we're all going towards the new modern clinics. I'll show you some pictures. That's a comprehensive care ambulatory clinic. This is one of the newer facilities, and this is up in Lame Deer, Montana. I've been to this facility. It's really in a pretty area. It's not too far outside of Hardin, Montana, not too far from Billings. That's a really pretty area. Once again, if you like the outdoors, fantastic. Clinics and hospitals are beautiful. That's the interior of that same facility. This is one of the newest. This is in Fort Defiance, Arizona. So that's about 45-minute drive north of Gallup, New Mexico, right across the New Mexico-Arizona line. It's a beautiful facility. Gives you an idea. I don't know if you can see those pictures down lower, but really beautiful modern facilities. So anyway, if you're interested in learning more about the Indian Health Service, that's their website. And I also have some contact information down there as well. My office is just down the hall, so if you ever want me to print you out a copy of these the email and phone numbers, I'd be glad to do that. That's about it.
Thank you. Mr. Conover, are you there?
I am here.
All right. What would you like to talk a little bit to the students about the programs?
I would. I'm here with Tina Arthur, who's our Missouri State lead. We're here in Kansas City. Due to technology difficulties, we're not live via the web. It's real unfortunate. I must be full and open. I have a special place for ATSU since I just received my master's degree. And ATSU has been a fantastic partner for over 2 decades plus with the National Service Corps. And certainly the resources and advocates you have and the people sitting in the room have an even greater story to tell than I can possibly, and Tina can possibly give you in the next few moments. I will say this. We have some fantastic opportunities for folks who are looking to go into primary care medicine. Not only financial resources that can be exceptionally helpful in student debt opportunities, but more importantly, finding primary care communities that you, as the physicians of the future, can look to settle down, find a fantastic practice opportunity, and put down roots in the community. That is precisely what this program, which was founded in 1972, is meant to accomplish. We are looking to partner with communities, practices, and providers to provide long-term solutions to chronic care and primary care needs of underserved urban and rural communities. This is community-based medicine. I know that there's a PowerPoint presentation that you have in front of you, as I understand it. I've also sent one to the dean and asked that this be forwarded to each of you via the ATSU system. It's a much longer presentation, about 70 slides. It's not something I'd even prepare to go through with you today, but basically this gives you a full background of information that would be in lieu of a handout, a packet I would give you today, or that you may have picked up at the Student Career Fair. Clearly, we're trying to drive you folks to a website. We have a very good website that really reinforces a lot of what you're going to see in this presentation here today, and gives you the ability to access stories from the communities of providers such as yourself all across the country. Basically, the communities we work with, the practices we work with, agree to take Medicare, Medicaid, have a sliding fee scale, and be part of the social and community fabric of impacting chronic disease and community wellness. These are sites that do not discriminate based on age, sex, race, national heritage, or economic income status. This is looking at the continuum of care and continuum of care of primary care that I know is such a central part of the ATSU curriculum. How the National Service Corps partners is we partner with the communities who have signed a contract with us and provide them opportunities through our Job Center website to advertise to you. I would encourage you all to go on our Job Center, which is an online web resource that's on the site, and there is a link in the PowerPoint presentation you will be receiving, that we partner with Google Earth. Clearly, this allows you to zero in any community across the country and look at a very street-by-street level, chamber of commerce level, school district level, church synagogue level, practice level of what this practice may look like all across the country. It's through those marketing efforts that we're hoping to connect providers with communities. The resources that we offer then is a secondary contract with our providers. We really have three opportunities, three gates to walk through. The first is our scholarship program. This is a competitive program. We just awarded approximately 220 scholarships. There is approximately 1,500 to 2,000 applicants. It is a competitive application program. I know there are people in the room at ATSU that have received the scholarship. It is a financial opportunity for you to have your tuition fees, reasonable education expenses, and a monthly stipend paid off 2, 3, or 4 years. The government does this in full. On the backside, then, post-residency, and you certainly can take an approved chief residency or primary care fellowship year as a 4th year, does not preclude that. But post-residency, we'll be looking to place you in general family practice, internal medicine, pediatric, psychiatry, or OBGYN medicine. Now, clearly, podiatry, emergency medicine, hospitalists, radiology, etc., are excluded from our program. So, for those of you who are in the room who can say to yourself today, I want to practice in a primary care setting in one of those 5 general disciplines. I am open to going from 2 to 4 years anywhere in the country. Have an experience, a Peace Corps-like experience is how we market it, but very clearly a community experience, in return for the federal government paying off 2 to 4 years of the ATSU in full education. Again, it's a wonderful financial benefit, but there's some serious strings, and you must be very clear, and I would counsel you must be very clear that you want to walk into this path. You have no greater resource and person to talk to than very clearly both Admiral Halliday and Dr. Wilson, who are there in front of you. They are both ambassadors to our program, and I would encourage you, if you're looking to go through the scholarship avenue or one of your classmates, to ask them what this means. So, because clearly it's a wonderful partnering, but you are walking into a box. The scholarship program will open for applications in January. It'll be available online. There's some resources there. For those of you who are 4th year students in the room, or in the future as your 4th year, we have what's called the Student to Service Program. This is a competitive program. This year we're expecting 800 to 1,000 applications. We'll award about 100 S2S awards. So it's 1 out of 10 scholarship. You're looking at 3 out of 20. This you're looking about 1 out of 9. It gives you $120,000 over 3 years, or $120,000 payable to you in your 4th year residency. This will allow you to buy down the principal on your student loan debt. The important piece is because as you all know, your student loan debt will continue to accrue interest based on the principal, even though it's deferred over your residency years. By taking $120,000 out of the principal, over 10 to 15 years, the financial people tell me you could avert between $120 and $250,000 in interest averted. This is, again, over 10 to 15 years. This is a substantial financial benefit for you. In return, post-residency, you agree to practice 3 years and a HIPSA score of 14 or above. These are county-based statistical census tract need scores or facility scores. Again, in our job center, you'll see where those places are. Those scores are changed every 3 to 5 years based on census data information and number of providers and population. Clearly, poverty does something to do with it, as does social demographics. Lastly, we have our loan repayment program. This is where we partner with students who are now residents and now out of residency and your final year. As you look to go into your first practice, we have our job center. It is free to you, as is the Rural Recruitment and Retention Network. I would strongly encourage you to never sign a contract with a recruiter, as the U.S. government affords 2 separate resources that is free, taxpayer supported, for you to do national job searches that include salary information, contact, email, phone number, fax, and address, along with websites for you to go out and promote and recruit yourself. Even though some of these recruiters may not charge you anything, they do charge the sites between $25,000 and $50,000. Dr. Wilson, as a former medical director at a Fairly Qualified Health Center, I'm sure can give you unique examples of how the cost of recruiters impacts rural America. Not to put you on the line, Maggie.
Very expensive, yes.
Lastly, though, the loan repayment essentially is if we will work with you to partner with a site, you will negotiate your salary and benefits. As I'm sure you understand from your classmates, that can be substantial. Really, very clearly, though, looking at what community best fits you and your family's need. I will tell you from talking to site administrators that retention is a key. But if you come home every day and your spouse says to you, "When do we leave?" this is not a retention possibility. So, which is why we really want you to look at the opportunity that not only fits you financially, but fits you both clinically and community-wise. Once you have that contract signed, you're able to apply for loan repayment. Essentially, it's $170,000 over 5 years. The program is currently tax-free. And that resources goes right to you to pay towards your principal. We do have people that stay with us longer than 5 years, but that tends to be the average. But there are avenues to stay longer if you so choose, or go into one of the state loan repayment programs. Hopefully that will provide a substantial benefit for debt reduction. And what that allows, and the example I use is there's the rural community in Iowa I was born. There was a scholar and a loan repayment that both came to Critical Access Hospital and Rural Health Clinic 12 years ago. The scholar obligation was paid off, and the debt was paid off to the providers of loan repayment. They're both there 12 years later. Members of the school board sit on the foundation for the local community center. My grandmother, who's 97, is one of their patients. But it's one of those success stories that clearly this is a community of a county of 4,500 that has long-term medical solutions because they partnered with an applicable federal program that was a win community and a win for the 2 physicians, both DOs, who have made that community their home. Again, if you have any questions, my information's on the back end, as is Tina's. More than happy to announce it. And we have had a long and prosperous relationship with A.T. Still University and really enjoy working with the students and residents that come out of these programs because we know they are a fit for the communities that we serve. And I will stop it there, but clearly we'll take any questions either today or in the future as you think of them. And thank you very much, Doctor.
Thank you. Thank you, Mr. Conover. Maybe just a quick personal side is, how many in here are interested in primary care? Probably most of you wouldn't probably be here today. You know, I served at my National Service Scholarship in a very small rural community in Kansas. I wasn't from Kansas, you know, I went there to do my service obligation in a town about 800. But the day I hit town, I became not only the town doctor in a 45-mile radius, but I became the physician for the local nursing home, the medical director for the local nursing home. I became the county coroner. I became the jail doc. I became all these things. And, you know, it was a great, great experience. Even though I ended up not staying there, a tremendous experience for me to learn and to personally grow, both personally and professionally, but to really give back, you know, give to a community in need. And I still keep in contact with the people I took care of there almost 30, you know, years ago. So, you know, it is a rewarding experience and a rewarding opportunity, and I would just say, you know, please explore it if you're serious about primary care, and I know Dr. Halliday would say the same of his experiences. Do you have questions for us? I think we want to give the last few minutes certainly time to ask questions that you might have.
So on the National Health Service Corps stuff, do they take into consideration the rise of tuition costs as you're moving forward? I noticed that they had sort of solid numbers for every year that you gave back. Do those numbers increase as tuition across the board increases?
Those numbers are solid, but they change. I mean, those aren't the same numbers, you know, a decade ago, right, Clark? If you're still there. You know, I know they weren't when I was there 20-some years ago. So they do change, but they don't change every year or anything like that.
I apologize. I did not hear, and this may have been from years of work with power takeoffs as a kid, the first half of that question.
Yeah, I'm sorry. He was asking whether the amount of loan repayment changed with rising tuition costs.
We actually had an increase this past year. We have increased the amount of loan repayment from $50,000 for 2 years to $60,000 for 2 years. That can be construed as a direct reflection. We've also had increased funding. You know, as Dr. Wilson will tell you, this program for years saw a pretty steady level of funding and numbers at about 4,000 to 4,500 nationally. Our latest report to Congress at the end of the last fiscal year said we had 9,078 people in the program, which is a dramatic amount of folk. Missouri happens to be #2 state in the country for placements, actually. So at this time, the awards have gone up. Where they go from here is not a question I will answer, as that is a congressional decision and a secretarial level decision.
Other questions?
So for the Indian Health Service, how competitive are the specialty positions? You don't want to do primary.
Sure. You know, a lot of it boils down to geographic region you want to go to. There are some areas that are harder to fill than others. So if you're flexible on location, for example, I went to Barrow, Alaska, which is 340 miles north of the Arctic Circle. If you're flexible, it's pretty easy to find what you're looking for. If you have a specific geographic area, if you say, I only want to go to Oklahoma City, especially if it's an urban area, it can be pretty competitive at times. So the key is flexibility. If you and your family are flexible on where you live.
Other questions? Yeah, in the back.
So most of us was in scholarship or going to public placement program. How soon should we be looking about where we want to go? Is it the location, the application, the program? I mean, what with me, you know that?
Sure, yeah. A question, so you can hear it too, Clark, was how soon to start investigating. Obviously, if you're a first or second year student, you know, you're probably going to be investigating the program, but not specific sites. If you're interested in the student to loan repayment, you may want to, you know, during your third year, start definitely looking into that to apply for your fourth year and be kind of thinking ahead. Otherwise, you know, if you're looking for the traditional loan repayment, you're probably not going to be looking for sites till your, you know, second, maybe early third year of residency, when you would typically, you know, start exploring where you might want to go. And again, know that it's really limitless, from Indian Health in Alaska to, you know, St. Louis to Kirksville. You know, I've been a medical director of a FQHC. I never thought I'd end up kind of staying in the system, but up until my new job here, I've been the medical director at the local FQHC. So, you know, there's just so many potentials for different places. You're going to have lots of choices when it gets closer to actually making an application for the program and trying to figure out a site.
And I'd echo for the Indian Health Service, you should really start looking about 9 months or so before you're available for employment. I wouldn't wait much sooner or much later than 9 months prior to your availability date. And I just wanted to echo, like what Dr. Wilson brought up earlier, that Indian Health Service works with you to put you in a location that you're satisfied with. They do not say you have to go to site X, Y, or Z. What they will do is present you the list of available opportunities and allow you to select which ones you want to apply for.
This is Clark. Let me add one more thing to that. Clearly, the Area Health Education Center there at ATSU is a wonderful resource that's right in your folks' backyard. And on that dovetail, I think what you can, as students, look to do is find some student experiences that are diverse. We tell folks, we strongly encourage them to do one Indian Health Service and or BOP rotation, to do one inner city rotation, and one very rural rotation. And one of the things that we hear from feedback is that they may say, rotation A, I hated it. Well, that's okay. It's okay to know what you don't like. Not every practice setting or every population is right for every person. But I think that bodes well for you 3-4 years down the road in residency as you begin to look at your job situations, that you know you have some ability to winnow the rows a little and narrow the search down to parts of the country or type of practice settings that you want to be in. Clearly, I'd say the only caveat to that is that if you plan to be a family practice physician that practices OB medicine, I would strongly encourage you to look at Indian Health Service and rural critical access hospital settings, because predominantly what we're seeing across the country is that those two categories are the largest cadre of sites that we are advertising through us. And this is due to changes in practice models in suburban and urban areas dealing with OBGYN practice groups and academic medical centers, along with finances.
James, did you?
Yeah, I guess my question was just kind of centered around the direction of National Health Service Corps. I know that with the ACA and the augmenting of repayment programs that are coming through the ACA, are those things that are going to be swallowed by the National Health Service Corps, like working for a non-for-profit for 10 years and getting some loan repayments there? Or is National Health Service Corps still going to be off to the side? Does it kind of provide extra money, or do they see an expansion? I know we didn't want to talk about
Right. I think this always comes down to governmental change and who can predict the waves of the future. I know I became a scholar, it's said, over 30 years ago. And they were talking about would it go away and would it evaporate back then, you know, and it hasn't. It's persistent. And again, Clark may be able to speak a little more from that level, but I don't think it's going away. I think actually more funds have been being put into these types of programs in recent years because they know the need is there. There is a need for primary care services to these populations.
You know, the election results aren't even certified yet. I don't know how, I'll be honest, I'm not real comfortable predicting the future. I will give you the answer that I give, and this is the governmental dodge. I can only assist and advise you on laws that are on the books. This program has been funded since 1972, continuously. We are under the Affordable Care Act funding to fiscal year 2015. After that, it's up to Congress, as any governmental program is. Again, this is a Nixon program that's been continuously funded from 1972 through 2015. If that provides you a historical timeline to make predictions personally, I will leave that on you, but clearly I'm not going to sit here and pontificate, unfortunately, what may or may not happen over the next 2 to 5 years in Congress. Clearly, though, the focus of this federal program and the entire Health Resources and Services Administration is on providing access to care to underserved persons and populations throughout the contiguous 48 states, Hawaii, Alaska, and the U.S. Trust Territories. Our focus is on getting people to providers to where the people are. And with a special focus on high need areas. I mean, when you look at high need, I can guarantee you very few things, but one of them is the Pine Ridge will always be one of the top areas of need in this country. And I certainly think Admiral Halliday would, I'm sure, is nodding that continuation. You know, there are parts of this country we know that have been underserved, not only for generations, but for centuries. Outside of that, we will continue to direct our resources and our people to those high need areas. And that is the one mandate that has never changed since 1972. And that is a mandate, I think, with the Affordable Care Act, we're all comfortable saying that's the direction of resources at this present time. How's that, Maggie?
That's great. I think that's a good note to end on. You're welcome to catch us afterwards for further questions. There are some brochures outside the room on the table if you have interest in particular pieces of what we talked about. And you're always welcome. I know Dr. Halliday and I are always available as National Service Corps ambassadors to visit with you anytime. So thank you. Thank you, Ava.